Hi, I'm Dr. Bradley Lamm. I'm the Chief of Foot and Ankle Surgery here at the Paley Orthopedic and Spine Institute in West Palm Beach, Florida, housed on the campus of St. Mary's Hospital and the Palm Beach Children's Hospital. So the goal of Charcot foot surgery is to, in general, save the limb. If it's gone untreated, this can lead to significant ulcers, infections, limb loss, and maybe even loss of life. So the goal of Charcot foot is to save the limb, of course, and improve the patient's quality of life. A lot of times these patients are 1 year, 2 years in a wound care center and the wound isn't healing. They're on a special immobilizer device or in crutches or on a walker, and this is not very good for their overall health when they're immobilized for such a long period of time, mentally and physically. So the goal is to get them kind of back to the community, doing what they typically do for their own health and also for the well-being of the community. Typically, Charcot foot surgery indications are, number one, if you have equinus or a tight calf muscle, that's definitely something you want to consider operation. And number two is if the foot is immobile or not stable, and every time the patient steps, it moves around, which can create an ulcer and infection. If the patient has some sort of deformity, maybe the Charcot is more stiff, but it's a lump and bump, or the foot's turned, or the arch is collapsed, these deformities of positions can create ulcers down the road, so that has to be operated on. And then lastly, of course, if you have an ulcer, infection of the skin, or a deeper osteomyelitis, that warrants surgical intervention as well. So those four indications are very particular, but very common and necessary for the reconstructive surgery to take place.